You're listening to the RC Executive Lounge podcast, the show where healthcare revenue leaders share real world strategies, hard earned lessons, and bold ideas shaping the future of revenue cycle.
Hi, everyone. Welcome to another episode of the RC Executive Lounge podcast series. I'm your host, Praveen, and I'm really thrilled you're all here. Today, we are honored to welcome Sandy Lood, Vice President of Revenue Cycle at Cottage Health. Sandra brings extensive leadership experience in healthcare finance and revenue cycle operations. At Cottage Health, she has been instrumental in improving patient access, strengthening revenue integrity, and driving innovations that balance financial performance with patient-centered care. Her leadership reflects not only operational excellence, but also a deep commitment to advancing the patient financial experience. Her contributions to the profession have been recognized nationally. Sandra was recently featured in the HFMA Member Spotlight, where she shared valuable advice for those entering the healthcare finance field and offered a glimpse into her own impressive career path. She is also an active thought leader shaping the future of healthcare. Most recently, Sandra joined a panel at the Women's Disruptive Leadership Summit 2025. Her perspective on how AI is transforming revenue cycle management, financial security, and clinical outcomes highlights her forward-looking vision and the respect she commands among her peers. We are thrilled to have her in today's episode of the RC Executive Launch podcast to share her insights on leadership, revenue cycle transformation, and the future of healthcare finance. Sandy, welcome to the show.
Thank you so much, Praveen. It's a pleasure to be here today, and really, truly, what a remarkable introduction. I appreciate all the very kind words.
Thank you so much, Sandy. Let's dive right in. So in our first section, we focus on broader perspectives of challenges faced by RCM leaders, but also we tend to narrow it down to an initiative, which is covered in our second segment. So with so many pressures on finance and RCM leaders today and RCM teams today, from payer delays to staffing gaps, which seems like a perennial issue for RCM teams, how do you go about setting your top strategic priorities, especially looking like 3 years ahead, as well as looking the next 12 months ahead?
Yeah, it's a great question. So really what I do is I really try to set our priorities as a group effort. And when I say group effort, there are two separate groups. One is I have our organizational leadership group, right? So it's our executive group. We really all have to be in sync and align with what are we expecting from revenue cycle and how are we going to produce on those outcomes. You know, there are so many initiatives that healthcare systems are going through right now. You've got growth, you have expansion, we have all of the government regulatory actions that are happening. So we really do have a lot that we're trying to manage. Not only that, at the core of our business is we're caring for sick patients, right? So we have to make sure that what I'm doing within the revenue cycle aligns with what the rest of my organization is doing. So I start there with that group first. Then once we are aligned at the executive level, I'm going to come back to my team. And the first and foremost I do with my team is once we have an idea of what the strategies are going to be, we have to gather data. We have to understand really what data we have, and that's really going to drive our decisions on what projects, initiatives we're going to be successful at moving forward to support our organization. Secondly, I don't just have my team go out there and start doing like product shopping or saying, Sandy, we have all these issues we need to fix, right? We have to have problem statements. We're doing a lot of work to write up and draft what is the problem we're trying to solve for, because it could be people, it could be process, it could be technology, it could be something that we don't even have control within our own entity, right? So we really try to figure out how we do that. And a lot of times when we're doing that, we're going to get stuck looking at, if we don't do that, we're going to get stuck and putting our efforts to something that maybe isn't going to be as impactful. You could have a little bit of a break in a workflow that, if it's just, a process, let's just address that. Doesn't need to be a really big focus, but there are going to be times where there are really critical information or steps missing, and that's truly where we need to focus. Another thing that we're really trying to do is I'm trying to work with my team to have really collaborative solutions that everybody's involved with. So even if we're trying to, let's say, solve an issue that's on the patient access team, I'm going to ask my HIM team, what are you seeing? When you're listening to the access team, who are our subject matter experts, explain their problem, what's going through your head? Because even though they may not be an expert in the issue we're trying to solve for, they're going to bring a really different perspective. Because throughout my career, what I've noticed is that when you're working with your subject matter experts and your SMEs, they can sometimes be very tunnel visioned. So when you get those interactive, collaborative conversations with folks who aren't as involved in the work, it really starts to get that creative and innovative thinking to problem solving. And it really builds the team together because now you're solving issues on priorities that you have all designed together. I think that at the end, too, when we talk about how we're prioritizing our strategic initiatives, we don't want it to be quantity based. I always want it to be quality based. Revenue cycle leaders across the industry are being asked to do more with less. Well, you can have people just really work accounts or work claims or work edits and just get things out the door quickly, quickly, quickly. But what's that eventually going to lead to?
Yeah.
You're going to have higher denials. You're going to have unhappy patients because maybe they're going to get a bill for a treatment that they never should have gotten a bill for. So we're really trying to tie all of our initiatives back to quality. I really want quality to be at the forefront because that's how you're going to continue to have all that great experience for your patients.
Makes sense. And normally, when you're doing these strategic prioritization exercises with your team, obviously they are going to come up with a lot of initiatives. We've heard from leaders that they have to say no a lot. But sometimes there's such a good initiative that you want to say yes to, but given the constraints, it falls just below the line. Could you maybe share an example of one such initiative, and sometimes in the last a year or two, where you had to say no to such a good initiative in favor of something even more critical?
Yes, so I am not alone when you say leaders get a ton of projects. So every year, my team gets together, we do a workshop, and we try to plan out in the middle of Q3 what we're going to start working on next year. At the end of that workshop, we probably have 60 plus initiatives that we're like, we're going to try to do because everyone comes, we've done our homework, we know what we're trying to solve for. We can't do 60 projects, right? And if we tried, we would be super unsuccessful. So really what we do is, since we can't do all of those, I'm going to get the team together and we're going to figure out what projects are going to support our organizational goals, which is what we call top goals, right? So what are those top goals that we need to address first? And we're going to align ourselves with that. So what can we do as far as financial stability? What are we going to do in order to support ambulatory growth or whatever it is that we might be working on? And then we kind of break it up into those categories of, okay, that's the goal that we're going to have to do for the organization. Here are some projects that are going to create positive net revenue. We have to add those to the list, and then we have those nice to have. So that's really how my team addresses trying to get down to those initiatives. And that's how I say no to some of these really great ideas. And when I say no, it's not always going to be a no, we're not going to do it. It's going to be a we're not going to do it right now, but let's add it to that parking lot list and revisit it. So a great example of what we did was when we were creating our goals, we identified, denials. Denials is something that everyone's talking about. We are very dedicated to having high denial recovery rates, but we haven't really implemented a true, what I would call a denials prevention program. We really have been managing the denials in revenue cycle and revenue cycle only. We haven't branched out to really talk with our clinical partners to tell them, here's denials that we're seeing in your areas, especially those high revenue producing areas such as your outpatient imaging or surgeries. So they are really great partners and they truly do care about their revenue too. So one of the goals for the team is we were going to create this denials management program. So everyone was like, great, we're going to create a charter, we're going to get reporting, we're going to be ready to go. So once we started the work, we realized we didn't have a really strong foundation. So I'm like, okay, time out. We have to pause on creating that program and let's start focusing on that foundation.
Makes sense.
We had reporting that wasn't accurate. We realized that what we call our RMC dictionary, so that's all of the mapping from your remittance codes to your actions. We had codes that should have been denials that were not creating denials and vice versa. So instead of moving forward with what we originally thought, we had to pivot and say, we got to fix these fundamental workflows and challenges that we're having and then go back to that.
That makes sense.
Yeah.
Awesome. You brought up a very important topic of denials. Every time we go to MGMA, HFMA, HIMSS, or any of these large events, we hear a lot about two specific topics. One is denial prevention, and the second is patient financing. And when I say patient financing, it's really patient financial engagement comprising of patient financing and financial assistance, right? Because these are areas where there's a lot of regulatory pressure, but also there is revenue and cash flow implications from addressing these programs, right? Where does something like patient financial engagement, thinking about patient financing or financial assistance, as well as denial prevention, fit into your strategic priorities or strategic roadmap, looking ahead 12 months as well as 36 months?
This was such a timely question because these are the top two things that I'm really focused on right now and into next year. So I appreciate that. If I could start with the denials piece first, right? That was work we had already started this year to try to get through and how we can truly create a denials prevention program. So we had to pivot, do the reporting, get our fundamentals ready, and now we're going to move back to that. I think that's the key, though. It's understanding your denials data and truly what is preventable. I think that's changed over the course of my career as well. What we would have considered preventable 10 years ago isn't necessarily preventable now. So we have to be able to really dig into that data and realize and identify what is truly preventable from our end. Because payers have their own tactics and they have their own way of adjudicating claims. And sometimes something we would consider would be preventable, they're always going to deny. So it's really understanding that and then breaking it down. You can't attack every denial at once. So it's coming up and working with your teams. So how do you want to do it? We went back and forth on, do we want to address one payer first? Do we want to address one department first? Do we want to address one root cause first to try to figure out? And I think the answer is going to be different for every organization. You're going to have to figure out where you're going to be able to find the best trending to start to make those incremental changes. And I think that's key, is understanding it's going to be incremental changes. Another tactic that we've been working on that we're going to continue to build upon is just having more robust JOCs with our payers. I am so pleased to share we had one of our payers here, I call it our best business partner right now, come to the table. Their net AR days were through the roof. We brought them data showing them that my organization was a total outlier with performance. They were underpaying us. They weren't paying us timely. And we were able to bring all of this information together. And both parties came ready to talk and collaborate and be open-minded. And they identified issues on their end. And then they identified issues on our end. And we were able to work those and solve them. After about 3 to 4 months, their AR was back where it needed to be. The AR days were down. The payments were coming in the door. And we continue to work together. And so the next step we're going to take is, how can we start to prevent those denials? What is the administrative burden on both teams? And where are we seeing the strongest recoveries? And what can we do to have it so that the payer is not going to be denying them anymore? So it's kind of the tactics that we're taking for denials management. As far as the patient financing, I am very fortunate that I work for an organization that has an overly generous charity care discount policy.
Very nice.
So thank you. We are very, very proud of that because we understand that within our patient demographics, we have a lot of individuals who have high deductible plans. Where I live is a very expensive area. So we do our best to really help our patients because we never want a patient to not seek care because they're afraid they can't afford it.
Yep.
So we have a very generous charity care. The other things we're trying to do is making payments easy for the patient. We've done a lot of education and training with all of our front office folks because it's not only patient access that reports up through revenue cycle. We also have our outpatient departments that have front office staff, our physician clinics that have front office staff. They all have to be educated on how to have these conversations with patients. So we really educate folks and try to help them understand how to do it like a time of service payment, using compassionate language with them. If a patient says, I honestly can't pay, okay, that's fine. We don't pressure them to, but let me then connect you with a financial counselor. Maybe there's opportunities that we have to help you get financial assistance or a discounted payment. Our bigger balances, we do work with our patients on having interest-free payment plans.
Nice.
And every organization has their parameters of how much they want to extend those payment plans for, but there's always the capability to flex that out based on a patient's need. And I think the other thing is just having the right tools for the patients to interact with. We're in even just within the workforce and within healthcare, you have multiple generations of folks, and everybody wants to access their care and their balances in different ways. Some want to call and talk to people, others want to self-serve. So we have to be able to have the right tools in place to help patients really do that. And I think it's just really addressing these conversations with compassion and understanding and working with your patients. Again, though, every organization is going to be different based on their demographics and what they're truly able to do. And then I think my final comment on this question is I am also very fortunate where I have a really talented eligibility team. So I want to give a huge shout out to them. They have a 93% conversion rate of uninsured to insured through our workflows. And it's just truly
That's
amazing.
fantastic.
Thank you. That this dedicated team, I believe there's about 5 of them that are able to connect with patients and help them get those services such as Medicaid or the ACA plans and connect them to get the coverage. Because a lot of times these patients are your reoccurring patients or come back. And so we're really able to help them with that. And we do offer assistance with other programs if folks have issues with transportation or food insecurities. We have programs that we're able to connect patients with on that too.
That's awesome. We are really glad to get to know about the robust program inside Cottage Health. With that, let's take a short break. We'll be back soon.
This episode is brought to you by rchq.com. That's ARCEEHQ.com. The Agentic AI platform helping healthcare providers improve financial performance by simplifying patient financing and financial assistance. From faster approvals to fewer write-offs, RCHQ makes it easier for patients to pay and for providers to get paid. Learn more at rchq.com.
Great. We are back on air with Sandy. Sandy, again, thank you so much for joining us today. Let's move on to the next segment. I would love to dive into a recent initiative that you led. What challenges were you solving for, and how did the program go? So, all yours.
Yes. So I thought about this question and I was thinking, should I do a successful initiative or should I do maybe one that wasn't so successful? And so I want to be the leader that I inspire to be, is transparent and to celebrate the failures. So we're going to go with one that was not so good. So we decided to implement some autonomous coding, and it was a true roller coaster of an implementation. We are on this, like I said, a rapid growth plan in our outpatient space, both on the hospital outpatient departments and our ambulatory. And so we just don't have enough coders to keep up with that. I also believe in my soul that outpatient coding is a less complex cases. It's a prime area to do autonomous coding. We have the documentation, the reports, and everything's there. The machines are smart enough to learn this. So I think it can be a really successful thing for organizations. What I was not anticipating was how challenging that implementation would be, because I thought, hey, let's start with some outpatient coding and it would be a really easy journey. And it really wasn't. So
Specifically, once you identified the challenge, how did you go about selecting a solution to implement or a methodology to implement? Or did you find a partner? And if you found a partner, how did you go about selecting the partner?
Yes. So our organization, we do an RFP. We do a request for proposals. So we come together as a group and we try to, again, it's identifying that problem. What problem are you trying to solve? Every organization has their boilerplate RFP form. So you have all that in there. And then we got to the questions about exactly what we were looking for. We sent it out to organizations that we had done our research on that we thought would be a good fit for us. We got those responses back and we narrowed it down to, I believe it was 3 top contenders. And then we did demos with them. We had a really robust scorecard after we did the demos to really identify who we wanted to partner with. And then we made our selection on who to partner with. One of the things that I'm pretty prideful on is we don't just pick the business partner that's going to be the least expensive or the one that has the biggest, bells and whistles. You really need to select the partner that's going to meet the need of the problem you're trying to solve for. And so just really making sure that you have, like I said, that scorecard where you have your boxes and you're able to really compare vendor to vendor in order to know who you pick. So that's how we were able to narrow it down to the business partner that we chose.
Makes sense. And let's talk about implementation. You mentioned that there were challenges, it went off the rails. What were the surprises and what were the lessons that your organization carried from the experience?
Yes, I would say that for this project, like I said, the implementation started off at like the giant drop. I think at the beginning there was there was lack of clarity both from our business partner and from the revenue cycle team as to what was in scope for this project. Because when we were trying to vet out a partner, when I'm oversee both the hospital and the professional side, so we really were trying to find a professional billing or professional coding tool, and it ended up shifting more to the hospital side. So we had a little bit of challenges with there because then it's different leaders, different perspectives. I also think that it's like AI is still so new,
Yeah.
and those of us who are not in tech don't understand it, right? And it can be a little bit scary. So it's how do we get our folks and our people who are going to be using the AI comfortable? How do we know what questions to ask? What can we do to support them to know that it will be successful? It just takes a little bit of hard work. We have to do a mind shift because we're going from people doing the work to a machine doing the work. So it took us a little bit to get through that piece. So recognizing the curve, the learning curve for both sides. And then I think just having very clear scope of it. Another area that we struggled with was how are we going to get this data over to our business partner when you think about we're doing it with imaging. Most organizations would just give the business partner all imaging, but I didn't want to do that. I wanted to start with just our standalone outpatient imaging. So we had a lot of challenges carving out that subset, which maybe in hindsight we should have just done all instead of a subset. But again, cautious. We wanted to be able to mitigate risk and how this was going to look moving forward. So it just took a little bit of time. So there's some pitfalls, and I think just not having a very clear picture of what success looks like. Is it the percentage of charges that are being are autonomously coded? Is it the reduction of denials? So we had a little bit to work through on there and to truly figure out what was success of this project.
That makes sense. I think that kind of covers my next question as well, given that you talked about metrics to track success. So with that, again, let's take a short break and we'll be back soon.
The RC Executive Lounge is proudly sponsored by rchq.com. That's ARCEEHQ.com, where Agentic AI is transforming how providers manage patient payments and financial aid. Providers using RCHQ are seeing more collections, less manual work, and greater access for patients in need. Visit rchq.com to learn more about the platform and schedule your personalized demo.
We are back on air with Sandy Lood. Sandy, now it's a good time to maybe shift gears a little bit into technology. You talked about AI. Again, it's a buzzword that we hear so much every time we go to an event. And more specifically, Agentic AI is the hot topic, irrespective of whether it's HIMSS, HFMA, or MGMA. So what role do you see as a leader in Agentic AI playing in the revenue cycle, either this year or looking ahead the next 3 to 5 years? What kind of a role do you see Agentic AI playing in shaping the foundation of revenue cycle management?
So I'm going to take a little bit of a different spin on how to answer this. I always answer this question from a people perspective first. So I think we all understand that AI is really here. AI is the future. If people aren't using ChatGPT in their everyday life to plan where to go to dinner or their vacation to Italy, you're behind. Revenue cycle, healthcare, we all need to start using it. It's I guess it's exciting to know AI is here and is a part of our everyday life. So when you look at turning it on within a healthcare system, especially within revenue cycle, you don't just turn it on and walk away from it. Your AI is not going to just replace the humans that are doing the work. So we have to change the way that our teams and our people that we have put a lot of investment in do the work. So instead of having those folks that are very transactional, we have to upskill them to start having critical thinking and logic. We have to hold their hands and help them understand your job of clicking 3 times to get a claim out the door. That's not what you're being asked to do anymore. Now we want you to root cause why the claim didn't go out the door, and then help build the AI or the bot or whatever it may be to fix it so you never have to touch it again. So it's also one of those things where you have to be really clear with your employees what the new expectation is. Because everyone gets scared that these, AI agents are going to come and take my job, and it's really not. We want to make your job more fulfilling. We want to make it so that you're using your knowledge and your expertise at the highest level that you can, that will then help expedite getting clean claims out the door that will then turn around and have a positive cash flow. So that's really where I feel AI is going. And I think there are organizations out there that are already doing a really great job in this. I would say my personal journey here is we're starting to get comfortable in this space.
Makes sense. And looking forward, do you think there are areas within revenue cycle management or in general broader healthcare finance where AI can truly shift the game? And I'm not talking about just incremental improvements, but real like 5x, 10x transformation.
I do. So this one I really had to think hard on. I think that some of the basic areas that AI is really good, I think coding, I talked about it. I know I'm like, it's my baby right now, is coding is really going to change. I think there's a lot that we can do on the patient experience side too. Really good AI agents are going to be able to talk to patients, and the patient's never going to know they're not talking to a human. It's going to help us get, those less complicated cases scheduled quickly, scheduled faster, scheduled 24/7. I refer back to, I have teenagers. My teenagers don't want to talk to anybody, but if they do have to, they're going to do it at like 11 o'clock at night when the rest of us are sleeping. They're not going to want to do it through regular business hours. So we have to kind of shift how we're doing our business, because most scheduling doesn't happen 24/7, but an AI agent can help it. That way, the patients know that they can call at any time. They're going to get their appointments. They're going to understand what's happening. I think that there's going to have to be a lot of AI just with provider and payer relationships. We have to figure out a way for the payers and the providers to work together to take over that administrative burden. And I think AI can get us there. Think about how wonderful it would be if my claims would go straight to the payer, that we already scrubbed it for everything and they just like automatically pay it. There's no issues or challenges. So I do believe in my lifetime AI will get us there to where that will be a reality.
That's fantastic. And we talked a lot about AI and agentic AI.
Mhm.
Are there other technologies, either specific to RCM or broader healthcare, that you and your organization are actively watching or exploring very closely?
Yeah, I think our biggest focus right now really is on that digital patient experience. We're putting a lot of focus and effort into there because we want to be able to meet our patients where our patients want to be met. At Cottage, we are about 5 years into this ambulatory space that we've never been into before, and it's a completely different ballgame than when you're looking at facility. On the ambulatory side, it's you have patients are coming to see their providers multiple times throughout the year. At times, it's not your typical inpatient hospital stay where you never come back again until you absolutely need to. So we're putting a lot of focus on how can we support that patient experience where they have a really great patient experience. We do have a lot of focus work groups on new technologies on the clinical side. I don't know all of the groundbreaking ideas that we have going on right now, but we do have committees that are bringing things forward. And every time one of those new ideas comes through, comes through our AI governance, I think there's a lot of technologies really in the OR that we're taking a look at, and how can we help bring in technology that's going to bring in really great patient outcomes? How can we have patients recover quicker, heal faster, not have to be under anesthesia for as long as they normally would have to be.
That's fantastic. Now, the next question is something that we ask almost every RCM leader, every finance leader, and every time we get some very interesting answers. So I'm genuinely curious and interested in hearing your perspective. Is there one metric that you as an RCM leader obsess over every morning? Like this is the first thing you look at in the morning. If there are data issues in this metric, really hell breaks loose and everyone is scrambling in your organizations to get the data right. Is there one such metric? And if so, what is that metric?
Yeah, so I wish I could say that there was only one. There's probably like 15 I could rattle off, but the one that I have the most obsession with is my cash. Every morning I want to know what's sitting in my remittance queue and what's hit the bank. Is it the same? Is it off? Where are we going? It's just so important because at the end of the day, that's what revenue cycle. I mean, that's our jobs, right? We want to collect the cash that's due to us for the great care that our organizations provide. So that would be my one that I'm probably a little bit more obsessed over than I should be.
Fantastic. Interestingly, another RCM leader named Sandy said the exact same thing. So, with that very interesting insight, let's take a short break. When we come back, we are going to talk to Sandy about leadership and the challenges RCM leaders face in healthcare.
Today's episode is sponsored by rchq.com. That's ARCEEHQ.com. If you're looking to reduce friction in patient payments and increase access to financial assistance without overwhelming your revenue cycle team, RCHQ's Agentic AI platform might be exactly what you need. Head to rchq.com to learn more.
We are back on air. Thank you, Sandy. So, as I mentioned, let's switch gears and talk about leadership and the challenges leaders face in RCM. Now, change is really hard in any environment, but it's more so in RCM environments because by nature, RCM environments are incredibly complex. I mean, talk about patient financing, denial prevention, financial assistance, Medicare. There is so much going on. How do you build momentum for change across your teams when you're trying to roll out a big change, a major project, something like autonomous coding to your organization?
Yeah, so first and foremost is you got to include the people doing the work in your decision making and discussions. We have to rely on our people that they know the workflows inside and out. They know where things are going to fail. They know where things are going to be successful. So we really try to include the people doing the work in any of our changes. I'm very transparent with the results and the why behind what we're doing. Why are we making this change? What is this change going to bring? Here's what we're expecting to happen. Because you don't want to just implement change because you think it's going to do something. And you have to know it's going to do something. So we want to be very clear on what we're trying to solve for and how we're going to showcase that the issue or that gap or that need was met. We recognize team members. If we have team members that are involved in these conversations and they identified an area that would fail, and it does, we call it out, be like, great job, Kelly, you told us this isn't going to work and it didn't, and then how about this? Tell me how it will work. What are your ideas on how it will work? That has been very successful. And I think the other thing that we try to do is you have to follow through with what you say. So if you come in with the change and you say that it's going to bring in $10 million a month extra, you better have your action support that you're going to see that $10 million. If you're going to put in an automation and you say it's not going to reduce FTEs, do not turn around and reduce FTEs. And just be transparent with folks. People take a lot of pride in their work. Everyone wants to come to work and they want to do a really good job and they want to work for organizations that are going to be successful. So it's just making sure that everyone stays involved in that. Now, yes, at the end of the day, leaders are responsible to make those hard decisions. But I always lean into my team because they are the ones that are experts and I want their voices to be heard. And that way, that makes me a better leader because then I'm making really informed decisions because I've brought them with me and I've also learned from them too.
Sandy, you've been a nationally recognized RCM leader for a long time and you've been in leadership for a long time as well. If you could give one piece of advice to another RCM leader or an up-and-coming leader or a CFO tackling similar challenges, what would it be?
Yes, I would say that we need to lead with compassion, but never lose sight of accountability. The work we do is so complex and we have so much high pressure that when we create a culture of it's safe to speak up, so if you see something, say something, and it's not encouraged, but it's expected, we're truly going to unlock the power of collective intelligence and integrity. I also would say you need to make the journey fun. You have to celebrate wins and failures together. You have to laugh together, and you just have to really build in the moments of joy that surround you in the workplace.
I think that's a great piece of advice, especially given how complex an RCM environment is and also how intense such an environment could be. So that's a great piece of advice. Thank you so much for that.
Yeah.
With that, one last question to close the day. What's a recent book, a podcast, a framework, maybe even an Amazon video or a Netflix video that has influenced your leadership thinking? And it has recently either fundamentally shifted it or changed it significantly?
Yes. So I'm an avid reader, so I have like 4 books that I'm reading all at the same time. I would say the one that I is really helping me right now, it's called Elevate Your Leadership, a 30-day challenge. The reason why I'm enjoying this book so much, it's reminding me of the basic fundamentals of how to be a really good, strong leader. Leadership, people that are in leadership, they know what it takes, and we go through it every day, but sometimes you just kind of forget that at the end of the day, you're not only just a manager or a boss and a mentor and a coach. Sometimes we're a therapist. We wear so many different hats because we're the ones that are driving the ship, right? So I am enjoying this book because it's just making me remember the simple things in leadership that are going to help not only myself but really my team be successful. And it's grounding. I'm truly enjoying it. And I've been reading one chapter a day and then trying to implement those themes throughout the next day. So it's really resonating with me right now.
Sandy, with that, thank you so much for joining us today. But most importantly, thank you for sharing some amazing insights in today's episode. I'm sure our listeners are going to be thrilled when they hear this complete episode. And they're going to walk away with a lot of practical takeaways and a lot to think about. To our audience, thanks for tuning in to the RC Executive Launch podcast series. If you enjoyed today's conversation, be sure to subscribe on Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And if you would like to be a guest on a future episode, head to rchq.com and look up the Revenue Cycle podcast series link to learn more. Until next time, I'm Praveen, and this is the podcast where RCM leaders lead the conversation.